H1N1 influenza hit California first and fast. Back in April, the California Department of Public Health began looking at who was affected and just how sick they became.
We actually found that over 30% of the patients who were admitted and hospitalized required intensive care and mechanical ventilation, and over 10% died.
If I can have you sit up a little bit so I can take a listen.
16-year-old Tiffany Lee was part of that 30%. On the mend now, she's been at Children's Hospital and Research Center in Oakland for more than 3 months, most of that time in intensive care, on a ventilator, and not able to breathe on her own.
Well, it definitely was a surprise. I did not expect to get that sick.
Dr. Arup Roy Berman treated Tiffany for a myriad of symptoms, including a 109-degree fever, liver, and kidney failure.
She got really ill really quickly, and the severity of her sickness just started escalating.
Dr. Janice Louie led research at the CDPH, looking at 1,088 patients who were hospitalized or died with H1N1 flu in California from April to August of this year. The study is featured this week in JAMA, Journal of the American Medical Association.
One of the most important messages of this study is that H1N1 infection can be a severe illness, even if you don't necessarily have the risk factors for severe complications. Even healthy people can get sick and hospitalized. Another interesting fact we found that there is the perception that the elderly are protected and have some pre-existing immunity, when in fact in our study, if the elderly were admitted and severely ill, they often ended up dying.
As for Tiffany, she is hoping to be home for the holidays.
Tiffany is a miracle.
Catherine Dolph, The JAMA Report.